wanted to just introduce myself. My name is Katie, and I'm actually recording from Savannah, Georgia. I hope everyone over in Pensacola is staying warm, because I'm already feeling the cold, even though it's not that bad, but still, too southern for this. Hope you guys enjoy. And my project is on Vivlodex. So what is Vivlodex? Vivlodex is actually a non-steroidal anti-inflammatory drug that was approved by the FDA back in October of 2015. So it's a little bit over a year old. And it was created by the Arroco Pharmaceuticals Company in order to meet demands for a low-dose NSAID. You might recognize the generic name for Vivlodex as meloxicam, and it's indicated for the treatment of osteoarthritis pain. Because this is a low-dose NSAID, the beginning dose of Vivlodex is 5 milligrams by mouth daily, and it can be increased to a max dose of 10 milligrams a day. However, it's recommended for those that are on hemodialysis to have a max dose of 5 milligrams a day. This drug has not been tested on children, and it's not recommended for women in their third trimester of pregnancy, as this can cause an increased risk for premature closure of the fetal ductus arteriosus. When taking this drug, there actually are two peak times. The first one begins 2 hours after ingestion, and the second 8 hours after ingestion. But this is based on a fasting study. When taken with food, the peak times actually are delayed by 3 hours. However, it does not decrease the effect of the medication when taken with food. The medication has a half-life of 22 hours, and it is metabolized by the liver. This drug should not be replaced with other forms of meloxicam, even when you're trying to make it the same dose. This will not create the same effect as the Vivlodex. Because Vivlodex is meloxicam and an NSAID, we're going to see side effects and contraindications that are similar to other forms of NSAIDs and meloxicam. Patients that we probably want to have avoid this drug are those who've had previous allergic reactions to NSAIDs and meloxicam, anaphylactic reactions, skin reactions, and those that have had asthma reactions related to aspirin sensitivity. Those that do have asthma that's not related to aspirin sensitivity need to be monitored for changes in their breathing if they are going to take Vivlodex. Also, patients who have had recent coronary artery bypass grafting, also known as cabbage, not the vegetable presented here, of course, on the slide, these patients are actually at increased risk of thrombosis when taking NSAIDs as a form of pain relief, including with Vivlodex. They can have an increased risk of MI, stroke, and potentially this could be fatal. They did find that fatality does go down after a year post-cabbage or MI. However, it is just highly contraindicated that these patients with extensive cardiovascular history should not be on Vivlodex. As I mentioned in the last slide, the incidence of thrombosis increases with NSAIDs, and that can lead to an increased risk of MIs or stroke. Also, with NSAIDs such as Vivlodex, you can see an increased risk of gastrointestinal bleeding, especially when combined with drugs such as aspirin, Coumadin, warfarin, and your other anticoagulants. So this could lead to ulceration, perforation of esophagus, stomach, or intestines. They did find that 5 patients that did experience GI bleeding, only 1 of them experienced symptoms. So I would probably want to recommend that you do a thorough history on your patient of their medications, and as well as they've had any past GI bleeding due to NSAIDs or aspirin or anticoagulant use. With NSAIDs, you can see a new onset or even worsening of hypertension, as well as increased risk of hospitalization due to heart failure. And this can be more likely due to the effects of NSAIDs on cardiovascular drugs, and that they actually diminish the effects. Renal toxicity is related to the renal papillary necrosis and injury. It can be related to the prostaglandin inhibition of NSAIDs. And as well, it can cause hyperkalemia. They did find that more of the renal toxicity is due to hypovolemia and dehydration along with Vivlodex. Once the hypovolemia and dehydration was corrected and Vivlodex stopped, renal function returned to normal. Since this medication is processed through the liver, you might see an elevation in ALTs and ASTs. When you are educating your patient, you want to probably give them the signs and symptoms of problems with their liver, such as nausea, diarrhea, flu-like symptoms, pruritus, jaundice, and tenderness in the right upper quadrant. Should you find these signs and symptoms during your physical exam of the patient while they're on Vivlodex, immediately stop the drug. Be sure to give your patient signs and symptoms of allergic reactions, such as anaphylaxis, exacerbation of asthma, or even skin changes. Also remember those patients that have asthma related to aspirin sensitivity, as these patients were contraindicated to take Vivlodex. Hematologic toxicity is actually related more to the anemia that may occur due to gross blood loss, which can be related back to the GI bleeding discussed earlier by combining Vivlodex with anticoagulants. If I haven't said it already, I'll say it again. Since Vivlodex is an NSAID, it increases your risk of bleeding when combined with anticoagulants such as warfarin, aspirin, and Coumadin. It also increases your risk of bleeding with SSRIs and SNRIs. Your hypertension and risk of heart failure increases because Vivlodex, as an NSAID, will inhibit your ACE inhibitors, your ARBs, your beta blockers, and even your diuretics. So when taking a diuretic and you're also on a drug like Vivlodex, you need to be monitoring their renal function. Also, Vivlodex, since it is a meloxicam drug, it will increase the serum digoxin level. So please remind your patients that they are not seeing angels. They need to get their dig level checked. As with anything that we put in our bodies, and if you remember from nursing school, a regular side effect of anything that is oral is going to be nausea, diarrhea, and abdominal discomfort. This medication is actually provided in capsules, and it is pink and blue. Meloxicam is usually a yellow pill. It is prescribed in bottles for 30 to 90 capsules at a time, and it needs to be stored at room temperature. And of course, remember to keep it out of hands of children, or out of reach of children, as I should say. Don't forget to educate your patients to read their FDA medication labeling inserts that come with their prescription, and as well as to have them voice any questions or concerns they may have about the medication. Again, I thank you guys for watching, and I hope you guys learned something about Vivlodex, and I hope you guys are having a great semester.